Hello all. Today we will be discussing ADHD, what it is, what behaviors a student with ADHD can exhibit, how to diagnose it, what the treatments are, and an effective class-wide intervention for not just the student with ADHD, but all students. So firstly, ADHD, it's attention deficit hyperactivity disorder. It's a disorder that can cause impulsive behaviors, restlessness, and inattention. According to the National Institute of Mental Health, some causes for ADHD can include heredity from your parents, uh, cigarette smoking, alcohol use or drug use during pregnancy, exposure to toxins, for example, lead at a young age, low birth weight, and brain trauma or other injuries can also contribute. So behaviors. Some specific behaviors or characteristics of students with ADHD, also according to the National Institute of Mental Health, some symptoms for inattention include overlooking details, careless mistakes in work or schoolwork, inattention in conversations, lectures, or play, losing focus easily, the inability to be organized, losing necessary items such as a pencil for schoolwork or house keys, car keys, and just general forgetfulness. Now, for hyperactivity and impulsivity, that includes fidgeting or squirming when told to sit, the inability to stay seated, the inability to complete activities quietly, the need to be constantly moving or on the go, nonstop talking, interrupting speakers, and trouble waiting their turn. It should be noted, though, that not all of these are signifiers of ADHD, and often there's a combination. Uh, According to the Learning Disabilities Association of America, these symptoms make it hard for the student to focus or pay attention when it comes to class or just everyday conversation or tasks. Their short attention span keeps them from completing their homework because, like I said, they get distracted very easily. So, how does one diagnose a student for ADHD? Well, according to the CDC, six of the symptoms mentioned either for inattentiveness or hyperactivity, six of them can qualify a student as having ADHD. That said, not all students with ADHD have the same characteristics or degree of behavior because there's three separate types. There is predominantly inattentive, which deals mostly with inattentive behaviors, just lack of focus or just general uh, aloofness. And then there's predominantly hyperactive or impulsive, which the student is unable to really sit down or just needs to be going constantly. And then there's the combined type, which has symptoms from both. Uh, Currently, there are 6.1 million students with ADHD currently being served in the U.S. And that number, according to the CDC, as you can see, has increased from 4.4 million in 2003. Now, some reported reasons for that increase, according to Cleveland Clinic, is that doctors are more willing to give the ADHD diagnosis because they know what it is better and they have more varied and more effective treatments for the students. Uh, Under the Individuals with Disabilities Education Act in 2004, students with ADHD are identified under the other health impairment. This comes from Lindsay Jones, the CEO of the National Center for Learning Disabilities. Now, there aren't any cures for ADHD, but there are treatments. Firstly, medication is pretty simple. You take stimulants to enhance your thinking or attention, and then non-stimulants can improve focus, attention, and help treat your impulsivity. Therapy is also effective because it keeps a routine and schedule and organizes everyday items. This makes it easier for the student to have a list of things they need to do that they can focus on better if they do it over and over again. And by organizing, it just helps them stay attentive more because they can find their items easily. Lastly, we're going to discuss the method of class-wide peer tutoring proposed by the University of Kansas. It works with students of all ages. It doesn't matter if they have ADHD or not. Doubles or triples the amount of learning time. And it's held in the format of a game to help the students focus on winning or competition. Helps them stay focused on that task. Some of those tasks can include spelling, math facts, sight words, vocabulary, and then for the student, the peer tutoring model, it runs off stimulus response. So there are two students, one that is teaching and one that is answering. So the tutor, is responsible for error correction, and the tutee must practice their correct answer 3 times in order to fully gain their knowledge, and that it benefits both of them. And this model is multimodal because it makes students listen, see, and say and write all in the same activity. Now, the reciprocal nature of this activity, you can switch your tutor and tutee and have them repeat, but make sure they learn. And there's built-in reinforcement between the partners because as teammates, they want to win, and correct answers, they help them win. So they reinforce each other when it comes to that. And with this model, it's very easy to measure the outcomes of it because, first of all, you can keep track of points. Say a student pair gets 5, and then a different student pair gets 7. You can attribute their scores to those pairs. And that concludes our discussion today. Thank you, and hopefully you can use these tips and facts to help you when it comes to teaching a student with ADHD.